Examination of the olfactory nerve. The olfactory nerve is the first and shortest cranial nerve. It is a special visceral afferent nerve, which transmits information relating to smell. It is one of the only two cranial nerves that do not converge with the brainstem. The olfactory nerves originate from the cell bodies of bipolar olfactory neurons in the olfactory epithelium. Olfactory neurons give off projections apically towards the outside world and basally towards the olfactory bulb, the central hub and coordinator of olfactory transmission. From the olfactory bulbs, olfactory information reaches the primary olfactory cortex via the olfactory tract. Assessment of the olfactory nerve. It is done by pinching or blocking of one nostril while the patient is blindfolded or with the eyes closed, then have the patient smell aromatic substances such as coffee, vanilla, and cinnamon, etc. Avoid using substances with a strong or noxious smell, such as alcohol or ammonia. Have the patient identify the substance based on its aroma. Then repeat the same procedure on the other nostril to compare the sense of smell on both sides. Interpretation of the assessment of olfactory nerve. Smell is intact when the patient reports detection of an odor. Recognition of the odor involves olfactory memory, which is a higher cortical function. Abnormalities related to olfaction include anosmia. Anosmia is the loss of sense of smell. This most commonly occurs due to nasal diseases like catarrhal sinusitis and hay fever. It can also be a feature of COVID-19. Parosmia. Parosmia refers to the perversion of smell. It is seen during partial recovery from traumatic anosmia or severe nasal infection. Hyperosmia. Hyperosmia refers to an increased olfactory acuity. It is occasionally a feature of the premonitory phase of migraine and can also be seen in Addison's disease. Cacosmia. Cacosmia is said to be present when the patient perceives unpleasant odors in the absence of stimuli. It is seen in severe upper respiratory tract infections and in atrophic rhinitis. Olfactory hallucinations. They are usually of unpleasant nature and characteristic of epilepsy, arising in the uncinate gyrus of the temporal lobe. They may also occur in psychosis. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.